Hi everyone. In today's video, I'm going to be going through the Renin-Angiotensin-Aldosterone Cascade. And this is probably one of the most important cascades that you can see in your body because it essentially allows for an effective control of blood pressure. And it involves three main players, as the name suggests: renin, angiotensin, and aldosterone. But it's the effects of these three main substances that have a lot of impact on the body, and they can actually be a cause of a lot of pathological conditions. And the main aim of a lot of medication that is used for especially hypertension is blocking the effects of one of these three, or in some cases all of these three substances within the body. So let's get started with the actual source, which is renin. Now, renin is not a neurotransmitter or a messenger in any way. Renin is actually an enzyme. Now, renin is released when the blood flow within the kidneys becomes low, and essentially the body recognizes that either blood volume is low or something is happening with blood pressure such that there's not adequate perfusion of blood within the kidneys. And that is the stimulus for the release of renin from special cells within the kidneys called juxtaglomerular cells. These cells are present within the glomeruli, as the name suggests, and they release this renin into the bloodstream. So we have renin at the top here. Now, the bloodstream, regardless of when the blood pressure is low or high, always contains a substance called angiotensinogen. And angiotensinogen is a substance that is created by the liver. The liver releases angiotensinogen into the bloodstream, and renin allows for the conversion of angiotensinogen into angiotensin 1. Now, angiotensin 1 is another key substance because it is essentially the precursor to the substance that causes for, I would say, 80% of the effects of the renin-angiotensin-aldosterone pathway. Angiotensin 1 flows from the blood into the continuous capillaries of the lungs, and the continuous capillaries of the lungs contain a special enzyme called angiotensin converting enzyme, or ACE. Now, angiotensin converting enzyme, is present in all tissues of the body, but its main action is seen within the lungs. Now, what it does is angiotensin converting enzyme, or ACE, converts angiotensin 1 into angiotensin 2. And angiotensin 2 is the main substance that allows for an increase in blood pressure within the body. So far we've come across angiotensin and renin, which are angiotensin converting enzyme, and renin, which are both enzymes. And the reason why I'm talking about these enzymes once again is that a lot of medications can specifically target these enzymes to allow for a reduction in blood pressure. We have renin inhibitors, which basically cut off this cascade at the source and allow for a reduction in blood pressure. Or we have what's more popularly seen, ACE inhibitors. And ACE inhibitors are the key first-line treatment for blood pressure. These drugs inhibit the ACE enzyme, therefore inhibiting the conversion of angiotensin 1 into angiotensin 2, and therefore prevent the effects of angiotensin 2 on the body to reduce blood pressure. So what are the effects of angiotensin 2 on blood pressure? Well, angiotensin 2 has four main effects on the body. The first effect that I want to talk about is called the activation of the thirst mechanism. Now, the thirst mechanism is a key mechanism in the body to ensure adequate blood pressure and blood volume as well as something called blood osmolality. Now, osmolality is essentially the concentration of various substances such as sodium ions, potassium ions, calcium ions, magnesium ions within the blood, such that the blood has enough volume. So if the blood osmolality decreases by a certain amount, or even if the blood volume decreases by a certain amount, the thirst mechanism is activated. This basically means that sweating basically stops, and a person's mouth becomes dry. And you might have noticed that when you become thirsty, your mouth becomes dry, and that's due to the thirst mechanism. Because the blood osmolality or blood volume has become so low, saliva production has decreased, because saliva is essentially just a contribution of blood. And if saliva production decreases, then your saliva or the internal environment of your mouth becomes a lot more mucus-like and a lot more thicker. And that signifies to your brain that there's a reduction in blood volume and we need to drink more water. So this activation of the thirst mechanism means that the person drinks more water, which allows for distension of the stomach and an increase in blood volume. And as you all know, if you increase the volume of something whilst keeping the size of it the same, then the pressure has to increase. So an increase in blood volume by drinking water increases blood pressure. Alright, so we've established that. Another effect of angiotensin II is the release of a special hormone from the supraoptic nucleus of the hypothalamus called ADH. ADH is called antidiuretic hormone, and as the name suggests, it is essential for preventing the loss of fluid from the body. Antidiuretic means it prevents you from urinating. So ADH is released from the brain and then goes all the way down to the kidneys and allows for the expression of more water channels in the glomeruli of the kidney to allow for greater retention of water, such that urination happens to a lesser extent and there is a lesser loss of fluid from the bloodstream. And as we explored before, through the thirst mechanism, if you lose less fluid, then that means that you're essentially maintaining blood pressure or even increasing it, because your body is also creating fluid constantly at a constant rate. So ADH, once again, allows for an increase in blood pressure. Now, an interesting fact about ADH is that when you drink alcohol, alcohol actually prevents the release of ADH from the hypothalamus. And that is why when, for example, if you drink a large amount of alcohol, then you have to go to the toilet more often. That's partly because of the high amount of liquid that you're drinking, because of the alcohol itself. But at the same time, because alcohol prevents the release of ADH, there's no barrier that prevents from excess urination from happening. So the person has to go to the toilet to a greater extent. Another more direct effect of angiotensin II that happens in the body is peripheral vasoconstriction. Now, peripheral vasoconstriction is basically constriction of blood vessels in the peripheries, as the name suggests, and this includes the hands, the feet, the legs, and the arms, and anything in the periphery. And as I mentioned before, if you decrease the container size, in this case the blood vessels, if you decrease the size of the blood vessels by keeping the volume of the blood the same, the pressure has to increase. So peripheral vasoconstriction, once again, allows for an increase in blood pressure. The final effect of angiotensin II, and what completes the Renin-Angiotensin-Aldosterone Cascade, is that angiotensin II activates the adrenal medulla, which is present in the adrenal glands, to release a substance called aldosterone. Now, aldosterone is a key substance that allows for retention of sodium ions in the water, in the body. So if we allow for the retention of sodium ions, then as we all know, wherever salt goes, water follows. So if sodium is retained, then water is also retained. And this means that if water is retained, then once again, coming back to the principle of an increased volume within a smaller space, there is an increase in blood pressure. Aldosterone is another part of the renin-angiotensin-aldosterone system that we can target if we want to lower a patient's blood pressure. Drugs such as spironolactone, aldosterone inhibitors, and prevent sodium and water retention in the body, therefore allowing for an increased amount of urination, and therefore they try to get rid of as much blood volume as possible so that blood pressure is reduced. One thing I did forget to mention before is that there are also ADH inhibitors. These inhibitors prevent the release of ADH or prevent ADH from binding to its respective receptors in the kidneys to prevent water channel expression, and therefore allow for increased urination to get rid of blood volume and therefore reduce blood pressure. So in review, today we've looked at the renin-angiotensin-aldosterone system. It starts off with the stimulus being a reduced blood pressure, which allows for the release of renin from juxtaglomerular cells. Renin allows for the conversion of angiotensinogen to angiotensin 1. Angiotensin 1 is converted into angiotensin 2 by ACE, or angiotensin converting enzyme. Angiotensin 2 has 4 main effects on the body. Activation of the thirst mechanism, which increases blood volume by drinking water and therefore increases blood pressure. Angiotensin 2 also allows for the release of ADH, which prevents the excretion of water out of the body and therefore increases blood pressure. Angiotensin 2 also allows for peripheral vasoconstriction, which is constriction of the arteries in the peripheries that reduces essentially the space that blood has in the body and therefore increases blood pressure. And then finally, it allows for aldosterone release from the adrenal medulla to allow for sodium retention and therefore water retention to allow for decreased release of water from the body and therefore essentially just increase in blood pressure. So I hope that has all made sense today. Thank you very much for watching.